Welcome to Unit 1 of this Planning for STI Service Provision module. In this unit, we will look at standards of care for STI treatment, the requirements for STI diagnosis, and how to scale STI screening and diagnosis based on resources. By the end of this unit, you will be able to describe the standard of care for STI treatment in ANC clinics, outline the inputs, supplies, and equipment required for STI diagnosis, summarize how to scale STI screening and diagnosis based on resources. How STIs and RTIs are detected and managed is usually guided by certain standards of care. Standards of care define good clinical practice, taking into account health system capacity and available resources. The minimum standards of care for a country, region, or healthcare facility are defined by decisions about diagnostic tests, recommended antibiotics, STI screening, and case management protocols. At national level, many countries publish STI guidelines, which should include standards of care for pregnancy. Standards of care for STI in pregnancy should indicate when to screen or test, which tests to use, criteria for treatment, and recommended therapy. Healthcare facilities within countries may have different standards of care depending on capacity and resources. The guiding principles for establishing a standard of care for STI in pregnancy are drawn from relevant WHO guidelines covering antenatal labor and childbirth and postnatal care, STI case management and STI treatment guidelines, and antimicrobial stewardship principles. Antenatal, labor and childbirth, and postnatal care should, quote, enable women and adolescent girls to survive pregnancy and childbirth as part of their enjoyment of sexual and reproductive health and rights and living a life of dignity, unquote. The objective is that every pregnant woman and newborn will receive quality care throughout the pregnancy, during childbirth, and in the postnatal period. The STI Global Health Sector Strategy is designed to end, quote, sexually transmitted infection epidemics as major public health concerns, unquote. The strategy targets a 90% reduction of Treponema pallidum incidence globally, 90% reduction in Neisseria gonorrhea incidence globally, and a goal of less than 50 cases of congenital syphilis per 100,000 live births in 80% of countries. Antimicrobial stewardship principles are intended to ensure that, quote, antibiotics are only prescribed for patients who truly need them, and if needed, the most appropriate drug, dose, and duration of therapy is prescribed, unquote. Antimicrobial stewardship is one of 3 pillars of an integrated approach to health system strengthening, along with infection prevention and control, or IPC, and medicine and patient safety. This integrated approach links all 3 pillars to other key components of infection management and health system strengthening, such as antimicrobial resistance surveillance and adequate supply of quality assured medicines. Once a standard of care is defined, it is usually the responsibility of the Ministry of Health and healthcare facility managers to ensure that the required diagnostic and treatment supplies are available to clinicians. The ideal standard of care for any country, region, or facility would permit STI detection and effective case management whenever possible. Minimum standards are based on both available resources, such as staff time, laboratory capacity, and essential medicines, and recommendations on when and how STI screening and case finding should be carried out, including clinical management according to treatment guidelines. Recommendations on when to screen or test for STI in pregnancy may include screen at first ANC clinic visit for syphilis and for other STIs depending on resources and local epidemiology, and test for STI when indicated by symptoms, risk, or exposure. Countries with relatively strong ANC services may plan to provide all of these, while other countries may plan for incremental progress, focusing initially on achieving high coverage for syphilis screening at first ANC clinic visit. How to detect STI may depend on several factors. Ideally, the most accurate and reliable diagnostic tests would be used, minimizing missed infections or false negative test results and overtreatment or false positives. Point-of-care tests give immediate results, making it possible to ensure same-day treatment. However, for many low and middle-income countries, or LMICs, there are practical limitations to work around. Current laboratory capacity and resources often do not permit reliable diagnosis or screening of gonorrhea and chlamydia. In many cases, the most reliable testing may either be too expensive or would require laboratory capacity beyond the reach of most healthcare facilities. The clinical management of STI also presents choices with a range of costs and effectiveness. Timely and appropriate treatment according to guidelines ensures optimal patient outcomes and reduces emergence of resistance. It is recommended to follow WHO treatment guidelines, and national STI treatment guidelines should also be consulted. These guidelines should be based on national and local patterns of antibiotic susceptibility patterns, especially for gonorrhea, which countries should monitor regularly. Anyone involved in improving clinical management of infections, including STI, and developing guidelines or standards of care are recommended to become familiar with the National Core Elements checklists for AMS. It provides essential structures that should be put in place to enable sustainable quality of care and appropriate antibiotic treatment for patients with infections, including monitoring and evaluation mechanism for the National Action Plan on AMR, integration of the AWARE classification of antibiotics in the National EML and formulary, up-to-date clinical guidelines that include AMS principles and integrate the AWARE classification of antibiotics, regulations on prescription-only sale of antibiotics, and measures to ensure continued availability of quality-assured antibiotics. You can download this checklist from the reading materials link below this video. For example, for women who present complaining of abnormal vaginal discharge, WHO recommends management based on quality-assured laboratory testing to treat gonorrhea and/or trachomatis and/or vaginalis. However, in settings with no laboratory capacity or with limited laboratory capacity due to constrained resources and reduced access to laboratory facilities, WHO suggests using the syndromic approach to ensure same-day treatment. Further, all women should be treated for trichomonas and bacterial vaginosis, or BV, when vaginal discharge is present, and treated for candidiasis if presenting with a curd-like discharge and/or vaginal itchiness. A syndromic approach is based on the identification of consistent groups of symptoms and easily recognized signs or syndromes, and the provision of treatment that will deal with the majority or most serious organisms responsible for producing a syndrome. Syndromic management for urethral discharge in men is a valid, feasible, simple, and cost-effective method to adequately treat large numbers of infected people. However, it is important to recognize the limitations of the vaginal discharge algorithms, particularly in the management of cervical, which are gonococcal and chlamydial infections. You have now completed Unit 1, Standard of Care and STI Screening. In the next unit, we will look at STI detection and treatment in more detail.